Good afternoon, everyone. I just want to welcome you back to Dental Specialties and the Oral Surgery Unit. I'm sure everyone's really excited to get into oral surgery. So to begin, I'm going to go through kind of the front sheet that's in your mods. So we're going to start with reading Chapter 56 and 53 in your Modern Dental Assisting textbook. So that's oral and maxillofacial surgery in your text, as well as dental implants in Modern Dental Assisting. And I also am wanting you to read your module and look at the outlines for oral surgery, implants, and the general anesthesia outlines. For this unit, you're going to be doing your workbook as you normally would. So you're going to do fill in the blank 1 to 20, multiple choice 1 to 20, and as well as the case study. And that is going to be 1 to 7. You're going to do, for Chapter 53, fill in the blank as well, 1 to 8. Multiple choice is 1 to 15, and the case study has questions 1 to 5. Since we can't really do a lot of discussion and answering and feedback and things, there's also an Evolve practice quiz that's set up with your textbook. So if you go into Evolve, just like you would for dental materials practice quizzes, there under student resources are the practice quizzes for both chapters 53 and 56, and they're 20 questions long. Just take a quick photo of those scores that you get for doing those questions and report in to me so that you kind of just have a little bit of insight into some of the questions that may be on your assessment. I am also working on, I have a few videos shared into your Brightspace, and as we get through the unit, I'm going to have more and more and more of those plugged in there for you to look at. For dental instruments for surgery, there's a lot of specialized instruments for the surgical procedures that I really want you to be familiar with and able to identify. So there are some videos in that, and also I'm going to upload chart notes template for surgical procedures and a consent form. That is just an example for you to look at to find out kind of what dental offices are educating their patients on before they choose to have a tooth extracted in their office. Okay. So here we go with our outline, I think. So everyone, please know that you can call me if you have any questions about any of this at any time. I prefer to be contacted through email, but if you need to send me a text message, you can absolutely do that. So please know that you can always call me. All right, so here are your learning objectives, and you can read through these on your own. They will be on your Brightspace PowerPoint that I'm going to upload there as well. Here's some more objectives, and here's our introduction. So for this unit, the introduction states that oral and maxillofacial surgery is the specialty of dentistry involving the diagnosis and surgical treatment of diseases, injuries, and defects. Maxillofacial is simply a term that describes a portion of the face that includes both the maxilla and the mandible. So in surgery, it's involving certainly removal of the teeth, but also the reconstruction of oral tissues if a person is in an accident or having a traumatic experience of any kind, the removal of cancerous or malignant tumors, or even benign tumors for that matter, and to treat defects such as cleft palate and those sorts of things. We'll be talking about those soon. So the indications for maxillofacial surgery are extractions of decayed teeth that cannot be restored, or the patient chooses not to restore the teeth, surgical removal of impacted teeth, extraction of any non-vital teeth that may have a chronic abscess or something that cannot be treated any longer, pre-prosthetic surgery to smooth and contour the alveolar ridge, and removal of teeth for orthodontic treatment, removal of any tooth fragments, removal of cysts and tumors, and any biopsy procedures. Treatment of fractures of the mandible or maxilla can also be done in a surgery environment, surgery to alter the size or shape of facial bones, the surgery of the TMJ joint, reconstructive surgery, of slip and cleft palate repairs, and salivary gland surgeries. And then finally, we're going to get into talking about surgical implant procedures as well. To become a oral maxillofacial surgeon, a dentist who has graduated from a dental school needs to go to an additional 4 to 6 years of post-grad training in a hospital residency. The oral surgeon is going to finish their core surgical medical year before the program completes, with an emphasis on surgical techniques, anesthesiology, and oral medicine. The surgeon must pass a national standardized exam of the American Board of Oral and Maxillofacial Surgeons as a requirement of their practice. However, with all of that being said, a general practitioner can also do oral surgery procedures in their office if they feel confident in their own skills in the case that is presented to them. They can absolutely do those procedures in their office. The standard of care listed in the state of Iowa states that in order to do general surgery practices, they are held to the exact same level of care that a specialist will have to have as well. As a surgical dental assistant, that person must have advanced knowledge and skills in patient assessment and monitoring in specialized instruments that are required to do oral surgery. They have to have knowledge and skills in surgical asepsis. So not only will they be disinfecting and disinfecting the room and sterilizing the instruments, but they need to absolutely be eating, breathing, and sleeping asepsis, meaning that they're not going to break the chain of infection control for their patients. It keeps them safe, keeps their patients safe, and keeps them out of the news. They need to also, of course, be knowledgeable in surgical procedures and pain control techniques. In your textbook on page 942, there's a nice big graphic on some of the other things that surgical dental assistants are responsible for in the dental office. Please take a look at that. The surgical setting is involved with the surgical team completing procedures in 2 types of settings. So there is a private dental office. Great River, even though it's an oral surgery office, is a private dental office. So they have suites throughout their clinic that they are able to do very simple to incredibly detailed and delicate procedures in their clinic. The hospital or outpatient surgical suite would be where the practice goes off-site of where they normally see patients to very closely monitor patients who have a very involved health history or patients who need to be in that environment to be seen safely. The surgical prep and understanding of aseptic protocol and knowledge of supplies that are necessary for the procedure, familiarity with the instruments used for procedure are all critical to your role as a surgical dental assistant. A routine will be followed with each patient that is seen in the practice, and the routine should not be altered unless specified by the dentist. But as far as aseptic protocol, that should absolutely be followed to the letter every single time. Each and every surgical procedure requires preparation and advanced planning by the dental team for each patient. Advanced prep needs to have all patient records and radiographs in order, have consent forms signed and available. I would recommend that every office where you work that does any type of surgical procedure have a consent form that's available for your patients to go through risks and any type of terrible case scenarios that may crop up for your patient so that they are aware of those ahead of time. Information requested from the patient's physician must have been received before we give anesthetic. So we need, if a patient is on a blood thinner, we need to know if the patient should have stopped taking their blood thinner or if they're healthy enough to have that tooth extracted. Check for any lab reports that are due for the patient. Ensure that the surgical setups have been prepared and are sterilized and ready for utilization. And then to provide pre-op instructions for any type of pre-medication for the patient. Pre-medication can go from prophylactic pre-meds for antibiotics to taking a couple of Valium to make them more comfortable during their procedure. So all of those need to be taken ahead of time. For getting the treatment room ready to go to see the patient, we should always place their protective barriers, and these are even more important in a surgical setting. Keeping the surgical instruments in their sterile wraps or pouches or cassettes until they are ready to be used. Have the appropriate pain control medication set out and ready for administration for your patient, and then also have the post-op instructions ready to provide the patient. These post-op instructions should have been given to your patient before treatment was rendered so that the patient is awake enough to understand and say, okay, I know what you're saying and comprehend those instructions. And also to have them written down and to be given to the caregiver who's going to be receiving that patient once the procedure is completed. To prepare the patient, we have to have an updated medical history and any lab reports for the patient. So again, if the patient is on a medication that thins their blood, we need to know that. We need to know what their INR was or their pro time to tell us how long it takes for them to clot. We need to confirm with the patient that any prescribed pre-med was taken as directed by their medical physician as well as the dental office. Have their radiographs ready to be viewed either on the computer in the operatory or on the view box. And here's where we take vital signs for every surgical visit. We need to take a vital sign as a baseline even before they have the anesthetic rendered so that we can kind of see how healthy they are for their treatment. We're going to seat and drape the patient and then finally position their chair.